As Tokwe said, Valentine is coming. You do not want to have one of these when Valentine's Day comes around. Those who know, they know. Well, yes, I went there. We're talking UTIs this morning on our health segment. Dr. Kuti Olatunde is a certified medical practitioner. He's worked in both public and private sectors with a keen interest in public health. Now, he's going to be talking about urinary tract infections. And it's a topic we've avoided. We ourselves, we kept moving it in our timetable because it's a touchy one. But statistically speaking, Dr. Kuti, tell us, how many people actually go through this?
Well, statistically speaking, a lot of females are more affected than males because of the body anatomy. And about 1 in 5 females actually have UTI. It's that common. In your lifetime, they would have UTI.
So 1 in 5 women have either been through it or are presently going through it. Exactly. That's like 20% of the population. That's what...
Exactly.
Goodness.
It's that common.
Okay. So, but this is not something, it's not a death sentence or anything like that, right?
No, it's not.
So let's break down what exactly UTI is.
Okay. UTI is just a short form from urinary tract infection. Okay. So it's infection along the urinary tract. And the urinary tract consists of the kidney, the ureter, the bladder, and the urethra. Okay. So if you have infection along that route, it's called urinary tract infection. To now break it down, we can have the upper urinary tract infection and the lower urinary tract infection. Okay. So if the infection is limited to the kidneys, it's called upper urinary tract infection. Okay. But anything below the kidney is the lower urinary tract infection. The lower urinary tract infection is more common than the upper one. The upper urinary tract infection is the more complicated kind of infection.
Okay. So I have to ask about which one is more serious, the upper or the lower?
Like I said, the upper one is more serious. Okay. Like if you have the upper urinary tract infection, it requires more attention than the lower urinary tract infection. The lower urinary tract infection is the more common one, easily managed, easily picked up, and it's almost everywhere. Okay.
All right. So now, what are the causes of these things? Because I remember my mom telling me when I was a lot younger that it's called a toilet infection, you know, that it comes from the toilet. Now, is this true? And if so, how can it be avoided?
Yeah, a lot of people believe that urinary tract infection is from the toilet. Actually, there's nothing like toilet infection. Okay. So let me just correct that. Okay. So there's nothing like toilet infection. Urinary tract infection basically is caused by organisms when they are found in the urinary tract. The most common one is called E. coli. Okay. Though we have other ones, but the most common is actually E. coli. And they usually get to that urinary tract infection by various means. So we have risk factors that can predispose the urinary tract to that infection. So risks like instrumentation. So if you put a catheter in the urinary tract, it's a very common cause of urinary tract infection. Then other things, pregnancy can cause urinary tract infection because of hormones that are being produced during pregnancy. They slow down the movement of the bladder. So the bladder doesn't extract the urine as fast as possible. And the urine is made up of waste. So it can aid the colonization of bacteria. Then also, people that don't urinate frequently, they hold on to their urine a lot, probably due to work or something. They are also predisposed to having urinary tract infection. People with abnormal anatomy of the urinary tract as well, they are predisposed to having a urinary tract infection. Like I said, females are more predisposed to having urinary tract infection because of a shorter urethra and close proximity of their bladder to the anus. So it predisposes them to have a urinary tract infection, and those are the common risk factors.
So whenever I hear E. coli, I think of a bacteria that you know, we're warned about when you have raw meat or raw chicken or whatever. So I'm wondering, how on earth is E. coli the same bacteria that's found in urinary tract infection as well as raw chicken and meat and the like? How is that?
E. coli is found everywhere, not basically just meat. You can find it even on the table, depending on how hygienic you are. It's even in the body system. So there are some places in the body that it's not harmful. It's called normal flora. It's not harmful. But there are some places that when you find it there, it becomes harmful. So part of the place where you find it, it becomes harmful is along the urinary tract. So it can get there by the bloodstream. The blood can carry it there. Or, like I said, if you hold your urine and you allow your urine to stay for so long, it's a very good culture medium for E. coli.
So this is not a sexually transmitted infection?
No. Though Though it's not a sexually transmitted infection, but sex can actually predispose you to having it, especially if you are using the condom.
Okay.
Condom can be a predisposing factor to having urinary tract infection, but it is not sexually transmitted.
Okay. Okay. All right. So now you've just told a lot of people about condoms, you know, sort of having a link with UTIs. I don't know. We're not telling people to not use condoms.
No, use it, but be hygienic about it, which is very important.
All right, fantastic. Now, there must be something that we can do as both men and women to prevent things like this happening so often. Are there preventative measures that we can take? Is there food we can eat, something we can drink? What can we do?
Well, basically, taking a lot of water has been proven to help with urinary tract infection. So you take a lot of water, it helps dislodge the bacteria from the urinary tract. Then cranberry juice. Though there's a debate between cranberry juice and cranberry tablets. I don't know if cranberry tablets is common in this our environment. We are used to the juice. But if you can get the cranberry tablets, it's also very good in preventing it. Then as well, don't hold on to urine for long. Once you're pressed, go to the restroom and pass out the urine.
I don't know whether it's a myth or it's true. What about using toilet tissue paper? So I heard that toilet tissue paper, because it's not often always sterile, could be a cause or, you know, linked to making UTIs more inflamed or
it's possible. Like you said, it's not a sterile material. So if you don't handle it properly, you can introduce the organism into the vagina. And remember, for females, the vagina has a shorter urethra, and that can help pass the bacteria down to the bladder.
So it's preferable to, I guess, use water then?
Yes, preferable.
All right. So now down the line, we've been talking about this infection, but we haven't put an age group to it. Is it something that kids could also be affected by, or older people, or is there an age group that's mostly affected?
Well, it can happen to anybody, right from newborn babies to old women and men. It can happen to anybody, though it is common now between the youthful age, but it can happen to everybody.
All right. So, Doctor, thank you so much for coming to talk to us about this. Now, we do not want this happening to us, do we, guys? No, let's take some preventative measures. If you have a question or two, put it up on social media with our hashtag WakeUpNigeria on TVC. Dr. Kuti will be answering some of your questions right there. We'll be back after this quick break. Stay with us.